all the way to the coccyx. And it comes in on the gluteal tuberosity on the femur. Also comes in and inserts onto this, which is the iliotibial band, or also called iliotibial tract. And so that's gluteus maximus, nice thigh extender. And then we have a gluteus medius underneath. Inferior to the gluteus medius, there's a piriformis, and piriformis is significant because it can cause sciatica if it's too tight. So there's a sciatic nerve coming out from underneath it. Okay. So that's all there. So gluteus minimus, you can't see.
Okay.
You cannot see it. All right, so then we can turn around. So here is our tensor fasciae latae, coffee muscle, and it also inserts onto this iliotibial band. And let's see, so we come into the anterior thigh. It's the quadriceps group primarily, so 4 muscles. And all 4 muscles are going to insert onto the quadriceps tendon. All 4 muscles are going to then, the quadriceps tendon goes over the patella and inserts onto the tibia. At this point, the tendon is called the patellar ligament because it goes from the patella to the tibia. Okay, knee extenders or leg extenders, same thing. Okay, the only one of these 4 muscles that crosses also the hip joint is the rectus femoris. So rectus femoris starts up at the anterior inferior iliac spine, so it'll also cross the hip. But the rest of the vastus ones, so vastus medialis, vastus lateralis, and vastus intermedius are all just starting on the femur and then going over to the leg. Okay, so there's your quadriceps. Then we come around and we have this nice long sartorius muscle. So the sartorius starts up on the anterior superior iliac spine, crosses the hip, goes way down to the medial tibia. So it crosses also the knee, it goes down to the tibia. Okay, so this is the longest one in the body. This is the one that helps you sit cross-legged. So all those actions into getting your thigh out and rotating it laterally. Inside here, we're going to have the iliopsoas muscle. This big muscle here is part of your adductor group, so this is adductor longus. There's a little muscle inside here that you can also see that's part of your adductor group. It also helps to extend the thigh, is your pectineus. So the femoral triangle is bordered by your sartorius, your adductor longus, and then there should be a ligament here, your inguinal ligament. Okay, and that borders these structures in here. So we have the femoral nerve, femoral artery, and femoral vein, and also some lymphatics in the corner. Okay, so that's your femoral triangle. As you come in towards the adductors of the thigh, we have your gracilis, our most medial muscle, or I guess, the ones in this straight up and down one, gracilis. Your adductor longus is here, your gracilis is here, and underneath your gracilis is your adductor magnus. Okay, so here, and you can see the adductor magnus there also. Okay, so those are all your adductors. Then when you rotate to the back of your thigh, the group, there's 3 muscles here, they're all called hamstrings. Okay, but the one on the lateral side is biceps femoris, the ones on the medial side is semitendinosus. The one down here underneath the semitendinosus is semimembranosus. Okay, so tendinosis and membranosus are together. They rhyme and they're on top of one another. Okay. So all these guys are hamstrings. So then we'll just go. I think that's the whole top, right? We can go to the legs. So starting off in the tibia, we're going to work this way. So there's our tibia. So this first muscle is called tibialis anterior. And if you dorsiflex your foot, you can feel that pop. And so that's what it does, dorsiflexes. And then next to your tibialis anterior, you're going to have muscles that will extend your toes. So when you extend your toes, you point your toes up to the sky. So this big one is your extensor digitorum. So it's going to extend the digits 2 through 5. And then this one down here is separate for the big toe. So this is your extensor hallucis longus. Okay, so extensor digitorum longus, extensor hallucis longus. Then you rotate to the side, and this is your fibula is here. So these are going to be on the fibula. So this is fibularis longus, fibularis brevis. And then to the back, you basically have your calf, right? So you have your big gastrocnemius, the 2 bumps of your calf are because of this guy. Gastrocnemius has two heads. So we have the lateral head, medial head. Underneath them, you have the soleus. So here you can see the soleus. Here you can see the soleus, and then you can take this off and look underneath for the soleus. Okay, so the gastrocnemius and the soleus both are going to insert onto this tendon. So this is called the calcaneal tendon because it goes to the calcaneus bone. Okay. So when it pulls up, it's going to plantar flex. Okay, so dorsiflex is up, plantar flex is down. When you take this off, there's three muscles underneath. Okay, so in the middle. So we have our tibialis anterior, flip it around, the one in the middle is the tibialis posterior, okay? And just like your tibialis anterior, which is next to the toe wigglers, your tibialis posterior is next to the toe wigglers, okay? So we have the, instead of extending, we're flexing. So we're gonna have a flexor hallucis longus and a flexor digitorum, okay? And the thing about this is like the hallucis is the one that's further away from the toe. So there's your big toe. You would expect this one to be the hallucis, but it's not. So that's kind of a weird thing. Okay, so just keep that in mind. And that's it. So tibialis anterior, flexor hallucis longus, flexor digitorum. That's it. Any questions?